All right, well, welcome everyone to Bladder Health for All Ages. Thanks for being here. For everybody here in person and on Zoom and anybody who might be joining in on Facebook Live. I'm Kelly Kraft, Program Manager here at Gilda's Club, and I want to give a little info about what we do before we get started. We are a cancer support community, and we provide 100% free psychosocial support to anyone impacted by cancer. So that's a person with an active diagnosis, that's survivors, that's people who've lost somebody to cancer, friends, family, kids, and teens. And then we provide that support with support groups. So we have educational workshops like this one. We have healthy lifestyle activities like yoga and meditation. And we're also a place that loves to have our social get-togethers and parties. And we're also a hub for resources and referrals. And I will let you take it away. Thanks so much for being here.
Thank you very much. My name is Beth Shelley. I am a doctor of physical therapy. I have 2 board certifications in women's health and pelvic muscle biofeedback, and I have a practice here in Moline. But tonight we're going to talk about healthy bladders and things that maybe you thought you knew that you don't actually know correctly. The reality is that when you are 2 or 3, somebody counts on the fact that your bladder is trainable. And you got to hope that person was right, because maybe they weren't right, whoever that person was. This is the reality that we are taught habits that our mom or aunt or grandma or whoever toilet trained you the first time, they're passing on what they thought was the right thing, which may or may not have been the right thing. So I want to try to smooth out the edges and make sure you get an idea about what really is the down low about how it should be. But here's the other thing that's very interesting. It is trainable when you are 2 or 3, and it does not stop being trainable. So if you are not careful, you're training it badly. And that's why it's really important to understand what is normal or desirable or what we hope for, and be able to work towards that rather than what we think is normal, which actually might not. Now, certainly we all understand that individuals have variations. So we're going to talk a bit broadly, and we're talking about situations in which the physiology is normal. So if there is, for some reason in your particular situation, something that has happened that has diverted your course, then we might have to vary things a little bit. And of course, I'm not providing physical therapy to anybody, so I can answer questions, that's for sure. And I hope you will have questions. So let's start at the beginning. The beginning of what comes out is what goes in. Is it not? Right? A lot of people say, well, I drink a lot. You know what my question is? What's a lot? If you look up in the dictionary the definition of a lot, what does it say? Well, it's certainly not a number. And I can tell you for sure, because I ask people what they drink. They write it down for me, so it's a real number. And they say, oh, my doctor told me I should drink a lot. But the doctor never tells you what a lot is, do they? Has anyone been told what is a lot, or what is it you should drink? What do you think? Anybody got an idea what you should drink?
I hear it on TV.
Yeah, what does the TV say?
It says take your weight and divide it by, take your weight and divide it by
2.5. Yeah.
No, I think it's just 2.
Yes, so if you take your weight in pounds, so if you're a 100-pound person, you cut that in half, and that's 50 ounces. That is a common formula, and that works often, but not always. And I will tell you, really, the answer is there's a great deal of disagreement. And I'm watching the literature all the time. There's a great deal of disagreement as to what a healthy adult, and I'm really speaking at the moment to adults because children are different. So when we talk about healthy adults, what should you take in? And the other clarification here is total fluid intake. We don't separate out water and then, some of the others. So total fluid intake, this is just for the healthiness of your healthy kidneys. Now, the reality is that there is absolutely a too little and there is a too much, but that is a really wide range. Now, sometimes the doctors will say, I do not want you, Mary Smith, to have more than X number of ounces. And that usually has to do with congestive heart failure. So if your heart is not strong enough to pump a certain volume, then you got to keep that volume down. So that might be what the doctor is saying on the low side. Sometimes the doctor says you should drink a bit more than maybe other people. And so what might be some of those reasons? Well, the biggest ones are diarrhea, vomiting, nursing a baby, or excessive sweating. There are certain medical conditions in which you should drink more and certain medications that you're taking that you should drink more. So sometimes more, sometimes less. And my official recommendation is pin down the doctor. Ask them for a number. What is the number for me? Now, it's usually a range. And in my practice, for a person who doesn't have any of those things, so this is not a person who's having trouble with vomiting or diarrhea or nursing or excessively sweating, and they live not on a mountain, which we don't even have here because that does make a difference. So if that is the case, my number, dun, 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 50 to 70 ounces. That's what I would recommend for an average healthy person. Now, the most common number that if you pin down to the doctor, they will say is 64. Have you heard that one? 8-ounce glasses. It's a pretty common one, right? So 64 ounces is very common. And I think for some people, they might not need that much. And other people do need a bit more. So 50 to 70. And you already know yourself that you're not going to have the exact same amount every day. That's not reality.
So do diuretic liquids change that number much?
They do not, but that would be a good discussion to have next. The first thing I ask for is the total volume. The next thing is, what are you drinking, right? So that's what you're alluding to, the what. And what is the diuretic fluid?
Green tea.
Caffeine. That's what it is. Now, they have done a number of studies. And over the years, when I first started in the 1990s, the recommendation was everybody with a bladder problem should get off caffeine. It's bad for everybody and you all should get rid of your caffeine. Well, I'm not a caffeine person, so for me, it didn't matter at all. But I know there are some people who are, and they just would not be okay with that. But we know now from some very good studies that the real answer is 50% of people. It's a coin flip. 50% of people have a bladder and a bowel that's irritated by caffeine. So what does it mean to say your bladder is irritated by caffeine? Well, what that means is about 15 to 20 minutes after you have your caffeine, you are rushing to the bathroom. Watch out, here I come. Everybody look out. I gotta go, I gotta go. And you know that little commercial with the bladder who's pulling the lady to the bathroom? That's what we're talking about. And that is a condition called urgency or overactive bladder. Now, it is important to have just a short divergence about the sensations of the bladder. You all know the body is not perfect. And your bladder is no different. Your bladder is not perfect. But ideally, a small volume in the bladder, you really don't feel anything. Maybe a little bit, but you don't feel anything. A medium volume, yeah, I know there's something in there, no big deal. This is called an urge. Yes, I can feel it, but I don't need to go. This is too interesting. But if you have a really large volume, you will have a strong sensation, an urge to go. Large volume, big sensation, that makes sense. But the thing that is never normal is the thing called urgency, where not only is it a really strong sensation, but it is so strong that it doesn't matter how interesting Beth is, you gotta go. And you're rushing to the bathroom and maybe leaking on the way, or at the very least, there's the fear of leaking. So that is what's called urgency, and that is never normal. Urgency is not normal. So we have a possibility of certain chemicals that we are taking in, whether that's a medication like a diuretic or a chemical like caffeine or alcohol, the most common. Artificial sweeteners get into that list, and for some people, even the amount of acid in food and fluids is irritating to the bladder. So when those things are occurring in a certain body that is irritated, there is the problem of urgency. So what would you think would be the best thing to do if you have an irritated bladder related to caffeine?
Either stop or dilute it with water.
In some way, cut down your caffeine. Now, most of the time, what we're talking about here is quality of life. Nobody is going to die of urgency, leakage, or bad sensations of the bladder. We're, test out all the things that are really wrong, like urinary tract infection. You're left with this condition called OAB. And if you don't mind having urgency, well, then go ahead and have the caffeine. But if it bothers you, then you got to make some changes. And sometimes it's the timing, right? So maybe you don't have the caffeine right before you're going to go on a long car ride, or you don't have the drink of alcohol right before bed, which makes you get up multiple times at night to go to the bathroom for some people. So understanding is helpful in making good choices. Because when it is unclear or unpredictable, that's upsetting. But if it's predictable, okay, I know I just had the caffeine. Okay, here it is. I got to go to the bathroom. Go have fun. That's what you want. But when it's not understandable, then that's upsetting. So we have the total fluid intake. We have the type of fluid. And then the last thing is timing of fluid. I kind of alluded to this with the right before bed thing. It takes about an hour for what you drink to get into your bladder so you can pee it out. And some people say, it goes right through me. I have a drink after the rest of the bathroom. Well, that was whatever you made an hour ago. Is not what you made now. And you know how you can test that? Asparagus. Because it makes your pee smelly and you can tell when it comes out. But take my word for it, it's about an hour. So to be safe, if you're concerned about getting up at night, to be safe, stop your fluids 2 hours before bed. And there you are. Now, the other thing that's kind of interesting to recognize is that caffeine has a half-life of 5 hours. So if you don't want the caffeine to keep you awake, stop your caffeine at least 5 hours before bed, before you want to go to sleep. Yeah, the calculation comes in. Yeah. So there are many things that are important on the side of fluid intake in order to help us have a healthy bladder. Any questions? Do we have any questions? Well, here's one. Why do we care that we're drinking too little? What is the problem?
Become dehydrated.
With drinking too little? Absolutely. There's many body functions that are going to be impacted by drinking too little, including dehydration. And is thirst a good measure of how much you should drink? No, it is not. We need to go by the number. And how much did you drink yesterday? Come on, there's nobody here who's got dementia, right? No, we don't know how much we drank yesterday. We're too busy living life to know how much we drank. How do you know? Write it down. So my first suggestion to everyone, if you care to accept the challenge, is to take a couple of days, usually 3 days, will give you your pattern. And if you work you should do some days of work and some days of not work. So you can see what the differences are. And just jot down what you drank and come up with a number at the end and see how close you are to 50 to 70. And if you're not in that 50 to 70 range, then see if you can inch it up a little bit. Or maybe you're too high. When I teach at St. Ambrose, I have the students do this, and I have some that are drinking 120 ounces, almost twice as much as what's recommended. So why do we care that it's not good, that we should drink too much? So what, we like water. I just want to drink. Some people do it so that they don't eat. Some people do it so they don't smoke. Some people do it so that they are bored and they just have a drink. Is there a bad to drinking too much? It is. It's called hyponatremia, and it is actually deadly. People have died of too much water intake. Now you have to really try for that. I mean, you have to take in 4 liters in 2 hours, you know, really a lot of fluid in a very short period of time. It is listed, excessive fluid intake is listed in the symptoms of schizophrenia. So it isn't good to drink too much. But again, we're talking about, you know, way over here, above 200 ounces a day. I do have some people who really feel like they need to drink more, so 80 to 90, if you really think that you need that much, as long as your bladder's healthy, go at it. And then on the low side, also the other thing is your urine should be a little lighter than these chairs. So a light yellow color. That's the color that you should have urine coming out. And when it becomes dark, it is a signal to you that you are drinking not enough. Understanding also that there are certain vitamins and some medications that can change the color to a darker yellow. But of course, you could check with the pharmacist to see if that's you. So fluid in. I wanted to take a bit of time because it has such a great impact. So now we have our normal fluid in. What should we have coming out? The reality of coming out has to do with the A word. Age.
That one.
That word, yes, the A word. And so an older bladder is typically in the late 70s. 75, 80, this is what we call an older bladder. So if we talk first about a younger bladder should be usually sleeping through the night, occasionally getting up once, in the middle of the night. An older bladder is often getting up once and occasionally twice. And what we do know about our frail elders is that if a person is getting up 3 or more times a night, they have a higher chance of falling and breaking their hip. So I know that we're not there at the moment, but we don't want to be in that position of having to get up 3 or more times a night.
Do they know what that correlation is caused by?
They do. It usually has to do with 2 things. One is when you're getting up in the middle of the night, you're not quite awake.
Yeah.
And when you're not quite awake and you're not really have good balance or very strong, then it's easier to trip up, even if you have a nightlight, which in many cases is useful. So it has that component to it. But the more often you get up, the more chances you have to fall. And the other challenge is if you are going quickly to the bathroom, you are more likely to fall. So there's a couple of components. And here's an interesting thought. Sometimes when I'm reading research, I think to myself, God bless the women that volunteered for that study. And this is one of them. So this was done in women who are 20s, young 20s, no babies, no dysfunction, no leakage, no prolapse, no injury, no surgery, normal normal women. They filled their bladder up with a known large volume. They put a pressure device inside the vagina, and they had them walk to the bathroom. And while they walked to the bathroom, they measured their step length, their up and down movement, what their arms were doing, how fast they went, all of these things, and the pressure inside the vagina. They went to the bathroom. Then they came back and filled them up again with the same large volume. And they asked them to walk quickly to the bathroom and then empty, measured the same things. What do you think they found? Well, intuitively, women with no dysfunction who have a full bladder walk slower to the bathroom. And they walk slower to the bathroom because when they forced them to walk faster, they had more pressure down on top of the bladder. So this is the double whammy, right? Because when you have urgency and you feel like, oh my goodness, I need to be getting to the bathroom quickly, you're moving quickly and your bladder is trying its very best, but it's irritated and you're doing this to it. So if you have an irritated bladder and you're trying to make it to the bathroom without leaking, go a little slower. It's counterintuitive, but it is successful. Yeah. Sometimes even just stopping. I am the boss of my bladder. I can do this. Don't let go yet. I'll be fine. I will get to the bathroom. Calming yourself, breathing, giving a moment. It's only about 30 seconds that you need oftentimes to just get the bladder to calm down just a little bit, and then you can make your way to the bathroom. So when we're talking about the day, this is often when urgency is its worst in the day. And urgency is sometimes, or most often, related to a trigger. Now you might think that it's just a full bladder. I have to go. Well, what does I have to go mean? What it really means is I have a very strong sensation. Does it not? Right? It means I feel it really strongly. That's what it means. But I am telling you right now, it does not mean you have to go. Because you can be the boss of your bladder. So, triggers. Hearing running water. Arriving home. Passing by the bathroom. Feeling cold. Doing something nervous, like giving a speech. So these are things that sometimes become trained. Remember we talked about training it badly? How do you train something? The way you train something is under the same circumstances, you do the same thing every time. That's how you train something. If you do not want to train something, then don't do the same thing. Be inconsistent. So what is one thing that your mother told you to do every single time in regards to your bladder? Pee before you leave the house. It was her fault. Do not do it to your children, especially your girls, your grandchildren. I know maybe the cat's out of the bag a little bit, but from now on, don't do that to your children. And try to be inconsistent for yourself. So that means sometimes don't go to the bathroom right before you leave the house. If you're going to drive 20 minutes and there's a perfectly good bathroom where you're going, don't go. If you're going to the Mississippi Valley Fair, I give you permission to pee before you leave the house. Okay? But if you're inconsistent, you're not training it badly. Because if you are training it badly, the one time that you try to leave the house without peeing, your bladder will become the boss and it will tell you. No matter what the volume of fluid is in there, you need to go. And you may have had this occurrence where you felt a really strong urge to go and you went to the bathroom and it was the tiniest little bit of pee. And you think to yourself, what was that about? Well, I'm telling you right now, it's about a trigger. And if you search for it, you can usually find it, whether that's an irritant like caffeine or alcohol, or it's a trigger like passing by the bathroom or hearing running water. The reality is that you can train it to act that way, and you can detrain it. You can train it out. And the way you train it out, let's take the running water. Never, never, never pee when you hear running water. Do not pee while your partner is in the shower. Do not pee while the shower is on, getting ready. Don't pee in the shower. If you're washing the dishes and you feel like you have to go, shut the water off. Get the bladder to calm down. Come on. Don't you do that to me. Calm down. And then I decide. It's like the toddler that's having a temper tantrum. Do we tell the toddler, you quiet down and then tell me what you want and I'll listen to you? That's what I want you to do with your bladder. I want you to be the boss. And once the bladder is calmed down, then you walk to the bathroom. That's how you become the boss. So when you think about the normal pattern of a younger bladder, an adult younger bladder in the day, it should go on a wide range of 2 to 5 hours in between going to the bathroom. On average, 3 to 4, but there are many reasons why we go to the bathroom, and so 2 to 5. Nurses and teachers have the worst bladder patterns because they don't go. They don't drink either, usually, but they don't have opportunities to go, so they hold it way too long.
What's the danger of holding it too long?
The bladder is like other organs. It can be stretched out. And if you stretch it out too much, it becomes floppy, and then it is not effective at empty. So too long, it usually means that you're not drinking enough. Now, when I see people in my practice that have complicated conditions, I have them measure the volume out and the time and the sensation, what the leaking or whatever other symptom it is, and the fluid that they take in. So we can really see the dynamics of fluid movement. Because, as I said before, sometimes the body is wrong. Sometimes it tells you that there's a lot in there when there's actually not a lot in there. And sometimes it tells you that there isn't very much in there when in fact there is. Here's another thing that's quite interesting. I think you all know that you make pee, you healthy kidneys, make pee 24/7. Every minute of every day, no matter what you drink, you are making pee. Now, the rate of urine creation, the number of drops per minute, that varies. If you don't drink very much, you will make less drops per minute, but you're always making pee. Sometimes people say, well, I didn't drink anything because I didn't want to go to the bathroom and I still had to go. Well, I hope so, because healthy kidneys make pee all the time. And if you're not making pee, then we got another thing we got to take a look at. So on average, if you smooth out all of the variations, the time of day, the fluid, the medications, you make about 20 drops a minute. So if you do empty every single drop from your bladder, in 5 minutes, you got 100 drops back in there. Ha. So trying to be empty is a losing battle. It isn't intended to be empty. And in fact, normal bladders leave as much as 2 ounces in there. And no doctor is going to be upset. In fact, in many cases, they're not going to be upset if you leave even 4 ounces in there. That's a bit individual. And again, we're talking about adults, not children. So it's okay that there's a little left in there. It's rarely going to be completely empty. And you are making pee 24/7. So in a 24-hour period, a healthy young bladder should be going less than 7 times. Again, we get back to can you remember how many times you peed yesterday? No. So there's the writing down. Another challenge I'm going to ask you, if you so accept, to write down how many times you went to the bathroom and track and see what you do. Now, older bladders, remember, are a little bit different. And older bladders, on average, are going to go 2 to 3 hours. So you don't hold quite as long as an older person. So more often going to the bathroom, smaller volumes, more times in a day. But still the total volume. But again, I would say, what's more? What is it, Mr. or Mrs. Doctor, that you want me to drink so that you are clear? Because sometimes it's not what you think.
Another question is, if you have low volume and it still feels like you have to go, what is that problem?
So this is the small amount of urine with a large sensation, right? And that is a form of urgency. That is a piece of urgency. Some people call it the sensitive bladder. And depending on where things have been occurring, it might be because of what you're going through. So if there is, for instance, something going on in this area of your body, oftentimes you become very aware. What's going on? Do I feel something? Is there something there? What might be going on? So your brain gets more alert to little things that happen all day long. And the best example of that is your bra. When you put your bra on as a middle school girl, it was kind of uncomfortable. I don't think I could wear this all day. I don't know about you guys, but now I get into bed, I forgot I got it on still. Because the body says, I feel this and it's not dangerous. So I feel it, I can tell it's there, but it goes out of my conscious. Whereas if I have something going on here, then a lot of these sensations are going to come to my conscious again and again and again. So that's sensitivity potentially here. Well, if you have something going on here that you maybe don't understand, or they don't understand, or they're trying to fix, then this oftentimes gets sensitive. This happens in endometriosis. It happens in painful menstruation. It happens when women have pain conditions of the pelvis that aren't very clear, where the brain says, what's going on? Is there something there? Should I pay attention? And sometimes you just have to say, I just went. It's all right. I know it's okay. Just settle down. Just like you did with the bra sensation, where you recognized, no big deal. Sensitive. It's okay to be sensitive, but not there.
Another question, sorry to keep asking, but
Yeah.
anyway, training, are the things you describe in training the bladder analogous to training the bowel?
Very good question. So our main focus of today was bladder, but I do think it's helpful to bring up a bowel because they're very similar structures. And so one thing very similar, caffeine irritates the bowel. Now, do we want to irritate the bowel? Kind of depends on the situation, because a lot of people use caffeine to have a bowel movement. So they have their coffee in the morning, and shortly after that, yahoo, I got a good bowel movement. So it isn't always bad to irritate the bowel, but I will tell you about a person that I saw at the very beginning of my work in the bowel and bladder back in the 1990s. She had driven 2 hours to see me. And she had 7 years of leaking bowels. And so we went through things and, what's your history? And this is what we're going to collect some records. And I told her how to write things down. And then I talked about the fact that sometimes caffeine is irritating to the bowel. And then we'll measure the muscle, this pelvic muscle or Kegel muscle we can talk about, and what we should do for that. And she's scheduled to come back in 2 weeks because it was a long way for her to come. And so we made it 2 weeks space. She called me after a week and I got on the phone. I said, hello. And she said, I am so mad. And I thought, what did I do? And she said, I wish somebody had told me 7 years ago to stop the caffeine because the leakage is completely resolved. So if you are leaking urine or leaking bowels, you really want to be careful about the irritants. But if you are having a difficult time emptying your bowels, then you might use that chemical to help you out. So there are some things there. The bowels are also going to respond badly to decreased fluid intake. The feces become very hard and it's hard to pass, very hard feces. So that is very similar. The bowels are also very trainable. Oftentimes people have a similar time every day. They're a morning pooper or an evening pooper, and they just have these patterns. So they are trainable that way too. Yes.
And you say that, but I can get up every morning and have to go at least 3 times before.
Right. So
if I go on a trip or if I'm going somewhere, I have to start earlier than anyone else just
to finish the bowels. Yeah. Yes. And this is a pattern. That's just the way your bowels work. The way that feces moves around is peristalsis, right? And when you have a really strong peristalsis, you move all of it to the end. But if it's not that strong, then you're going to move some of it. And then you got to go back and pick up some more and move that. And then you got to go back and pick up some more and move that.
Oh yeah, I can even go in the middle of the night.
Mm-hmm. Yep, some people can. That's
It's
just
interesting about the
pattern.
caffeine thing, because I think I could connect an issue with caffeine.
Yeah. And is it helpful or harmful? That is part of the question.
Yeah.
Now, that kind of brings me to another thing that's very important in the way of bowel and bladder. And that is, how do you position yourself to empty? Now, I'm not sure if we have some men on our Zoom or Facebook, but obviously it's different for men. And when I see men, I will ask them to try both sitting and standing. Some men are much better in standing. They just relax better. It's the habit. It's what they know. So that's their best place to relax. And other men, especially as men get older, they relax better in sitting. But I will tell you where nobody relaxes well. And that is hovering. My mom was wrong again. Hovering contracts muscles in your leg that increase the tension in your pelvic muscle or Kegel muscle. And if you do not relax your Kegel muscle all the way, you will not empty your bowel and bladder all the way. So I am encouraging you all to sit fully on the toilet. You can buy little purse packs of toilet cover things, the little paper toilet cover things, you can buy those. Or you can take little pieces of paper and put it down on the toilet. Whatever you decide to do, you know that the only way the toilet seat gets wet is if you hover. So those people who are worried about the dirtiness of the toilet seat are making it dirty. How ironic is that? Put the papers down if you need to, or sit down and relax your legs, relax your body. Now, I am not usually of the mind to say that men are right, but I'll admit it. And in this case, men are right. Because typically women go in and pee and get out. We got things to do. Men go in and they relax and they sit and they have a magazine and Maybe too long, I don't know, but it is good to sit, relax, relax your breath, relax your belly, relax your glutes, relax your legs, relax your pelvic muscle. When you do that, that gives the bladder the signal to squeeze, empties out what it can. Then close the door, squeeze the muscle, tighten up your pelvic muscle, wipe gently, no scrubbing down there, right? The skin is fragile and it's not a good idea to rub on your perineum and vaginal skin. Gently prodding, and then off you go. Now, bowels are a little different. You notice in all of that thing, I did not say push to pee. Don't push to pee. The bowels are different, of course. We need to have a little bit of help. We need peristalsis, so you only go when you have an urge. But it is a good idea to lean forward and bend at the hip, or get a squatty potty. Maybe you know what those are. Bring your feet up, but either way, you have a closed hip, relax your sphincter, and then make your belly wide. That's how you relax your sphincter. If you pull your belly inward, your sphincter stays closed. But if you push your belly out, then your sphincter opens. Straining is not normal, but you do need to push a little for bowels. And again, close the door up and off you go. And maybe you need to come back, and that's okay. It would be better to go off and come back rather than to sit and work at it. I've had some people hours on the toilet. No, this is not right. Absolutely. Other questions? Anything from online? No, not yet.
Made a distinction around the strengthening of the muscles in the pelvic area versus relief of urine and bowel, right?
Yes,
And because in Africa, they have the squat toilet,
yes,
right?
yes,
And the theory is that African women have less incontinence because they're strengthening the muscle on a squat toilet. And so I've also heard we're doing squats in the gym is the best exercise for strengthening the muscle.
You have touched on a couple of important things. One thing to discern different is hovering is not where they pee in Africa.
Okay.
Okay, so they pee in Africa, and this is where my old knees get in the way, but they are way down here. And it is really hard to squeeze your pelvic muscle down here. So this is a really good place to relax. But if you are doing that while you're cooking, you are squeezing your pelvic muscle, but that's down here, not like squats that you would do in a gym. So what would be the influence of the pelvic muscle? It is important to recognize in all muscles of the body that we want to make sure we have a good strength, endurance, speed, timing, and ability to relax. This is normal muscle. And the same thing with the pelvic muscle. So depending on what the symptoms are, I'm going to target the program in different ways. We have a lot of data. Dr. Kegel, he was a real guy. Did you know that? Dr. Arnold Kegel, I actually have a video of him in the 1970s explaining his research. And he only treated women, so please remember, Kegels are not for men. There's a different thing for men than for women. So that's interesting to recognize. But what he did was strengthening the muscles. And we have a lot of research about how this works. And over 100 randomized control trials, really, really good research, very good agreement that pelvic muscle exercises decrease urine leakage. So we have that understanding. But when they talk about that thing called pelvic muscle exercise or Kegel exercise, what they're talking about is a situation where you're only squeezing your pelvic muscle, so isolated, not using other muscles, and you're not doing anything else. So it's not while you're driving the car. It's not while you're talking on the phone. It's not while you're waiting at the grocery line. Now you can do them then, but if you need strength training, then you need something more than just those squeeze and relax things that you do here and there. Now that's isolated pelvic floor muscle training. On the additional side to that is what's called functional training. So that's where we understand muscles work together. And I already told you that when the belly pops out, the pelvic muscle relaxes, right? Well, the opposite is also true. When the belly pulls in, the pelvic muscle also pulls in. So when you're lifting up a box, I do not want you lifting up a box with your belly popped out because your pelvic's not going to help you. That's where sometimes people leak when they're lifting things up or exercise. So if you're exercising, you want to pull that in, and that will help the pelvic muscle have its best advantage, the belly muscle. We also know that the inner thigh muscles and the gluteal muscles are also helpers of the pelvic floor. Because of course, you know, when you have to go, you're going to do this. Now, you know, just squeezing your legs together is not going to keep urine in, because it probably hasn't, right? So what it does, squeezing the legs together helps to encourage the pelvic muscle to squeeze. And when you encourage the pelvic muscle to squeeze, it sends a message to the bladder that says, not now, chill out, don't squeeze, and it relaxes the bladder. So this is what I call cheating. If you are trying to do strength training because you have a problem you're working on, then don't use inner thigh, glutes, or belly. So it's kind of answering a little bit.
No,
Yeah.
thank you.
Yeah, and there are actually two exercises that you are doing in the gym, I think, more often, that have been shown to be helpful. If I really can't get somebody to do it, and they are your favorite, I'm sure. Plank and bird dog. Bird dog is the one where you're on hands and knees and you go opposite arm and leg. I know, our favorite, right?
That's hard.
Yeah, well,
Yeah.
I like it.
yeah, it's good. It's good. It is a little better than planks. I agree with you on that. So before we finish up, I do want to mention a moment about pads. Because women are often fairly comfortable wearing pads. You know, we had a pad event for many weeks of our adult life. We wore a pad. So yeah, just pad's okay, right? We just wear a pad. We'd be fresh, right? Well, here's the reality. You all your life have had vaginal discharge coming out. And it gets a little bit more when you're older, especially right around the time of the life change. And if you have a pad on and you have vaginal discharge come into your pad, it stays wet. And it makes you think you're leaking urine. Whereas when you were 20, you didn't wear a pad, you had some vaginal discharge come out, it evaporated. Do you remember that white smear on your undies? That's vaginal discharge. And it's supposed to evaporate with our healthy cotton undies, which I hope you're all wearing. So wearing a pad can actually make you feel wet. In addition to that, we all sweat down there. So that makes you feel wet. Now you're fully convinced that you're leaking all the time, but it's just sweat and vaginal discharge. So if you can't feel it coming out, challenge yourself to take the pad off. At the very least, even if you are leaking urine, as many times as you can, you should be wearing the smallest pad you can. Because here's another thought. Your subconscious brain knows you have a bra on. It also knows you have a big pad on. And maybe it's not that important to hold it because I got a big pad on. So I'm just going to let go a little bit. Well, I'm not sure about you, but I don't want to give my bladder that signal. I want my subconscious brain to be on board. You got to be on task here, Mr. Brain, and tell that muscle to do what it's supposed to do.
So
Yes.
I've noticed I've started sweating a lot more.
Yes.
So I'll wear a pad because otherwise my underwear will stay wet.
Yes, it is a bit of a challenge, and it is something that you should talk with the doctors about, but typically the sweating is on the legs. And sometimes it works to put on your underwear and then put some cornstarch in the creases. That can be helpful in decreasing sweating. But it may be something that you need to talk with the doctors about because there are some conditions of that.
I've noticed a lot more sweating this year. Even in my face, I'll go out and work in the yard and I just have sweat running.
Yeah. And it may be a temporary thing that just has to do with what's happening at the moment in your body, or it might be something that's kind of there. Now, another thing that's important is the health of the skin. And skin does not like wet. So if you do have the trouble about sweating, you want to change. It's a panty liner you're using?
I've recently just changed to like a poise pad, but just trying different things.
Yeah, the good thing about the poise is it kind of pulls the wetness away from you a bit more, but the panty liner gives you a chance for airflow. And it would be very important not to wear a pad to sleep.
I don't know.
Give your perineal area a chance. Don't wear the pad to sleep. But change it often if it is wet, because I've seen diaper rash. I've seen the raw skin occur. And sometimes it's the type of pad that's irritating your skin. Sometimes changing to a different pad can be useful. But it is interesting to recognize that menstrual pads are suited for a thicker fluid, whereas incontinent pads are more suited for a thinner liquid, like urine. So try to decrease the pads for sure.
Peristalsis is affected by long-term chemo treatment. And can that be restored through physical therapy?
Unfortunately, the peristalsis is a tough one. I do have a technique of abdominal massage that I have taught some people to try to stimulate and encourage in a certain way. Sometimes heat is useful. And then we get into the other influences like stress, breathing, walking. And it's kind of a hope that it will work thing, but they're all good, healthy things anyway. We have covered a lot.
Yeah.
Mm-hmm.
Anybody
Question?
online, feel free to chat in your questions if there are any.
I have another question. You said that Kegel muscles are not done the same by men and women.
That's correct.
Would a plank help a man as much as it would help a woman?
Well, you would think that that would be true. Well, I actually don't have any research. I don't know that it's never been tested in men, so I don't really know. I would suspect. That's as good as I can tell you. Okay. Now, the big difference between men and women is the fact that the men have much more in the front than the women do. And if a man is having a difficulty with leaking urine, then they need to train the front. Women, on the other hand, have much more in the back. And so regardless of whether it's a bowel problem or a urine problem, we do have our best focus in the back. And the best instruction is hold back gas. Not glutes. And we're talking about the ladies, right? So pinching the rectum, elevating it up towards your head. Nobody else knows you're doing this because you're not, you don't do this. You don't do this. There's no butt squeezes. Inside, that's it. Now, I do have in my practice 2 different machines that I can use to show you the pelvic muscle and what it's doing. So we're not guessing. It's a very scientific training process. And once you get it, you know it, you feel it, well, then you gotta keep doing it. Another question? No?
What
Yes?
does it take to get referred for pelvic training, like with someone like you?
Yes, it depends a bit on the insurance you're hoping to use. For Medicare, you have to have a doctor's referral. Otherwise, you do not. Yes.
I know I go walking with friends once a week and we always go out to eat afterwards.
Mhm.
It is not unusual for me to have a big glass of water as soon as I sit down.
Mhm.
Of course, I've been walking and I usually don't carry water with me. And it's an hour and a half of walk and then I'll even have a second one. And I know everybody else is at the table, like, they know I drink a lot, especially at lunch. You know, I'm not to say I do it any other time, but I do that. Not
Okay.
anything unusual, or it's just, maybe it's the social thing, I don't know.
Yes, yes, and so really the question is your bladder happy? And if your bladder is happy, it's fine. I heard somebody say, I want a gladder bladder. I thought, that's so cute, I want a gladder bladder. So that's what I do.
We don't have any questions online.
Thank you.
Great.
This was awesome.
Yeah.
I'm glad. I hope it has been helpful, and I would encourage you all to share the information. Share it with your girls in particular. Share it with your mother, your aunt, your friend. Let people know, because there's a whole lot of misinformation. Thank you, everyone, for joining me tonight.
Thank you.
Thank you, thank you.
And I just reminded